7 videos in, 78 comparisons completed. And if you have been following this series from the beginning, you have built comprehensive knowledge about cat care that extends from nutrition through health management through environmental optimization, covering every physical dimension of what cats need to thrive. But there is one critical dimension we have not yet addressed in depth, and it is the dimension that most directly affects your daily relationship with your cat, that determines whether living with cats is joyful or frustrating, and that separates households where cats and humans coexist peacefully from households where behavioral problems create ongoing stress and conflict. That dimension is behavior and training. The fundamental misunderstanding that creates most cat behavior problems is the assumption that cats cannot be trained or that training cats is impossible, because cats are independent and uncooperative compared to dogs who are eager to please and responsive to instruction. This assumption is wrong, and it causes owners to tolerate behavioral problems that are entirely preventable through appropriate training, or to respond to problems with punishment and frustration that worsen behavior rather than improving it. Cats are trainable. Cats learn constantly from their environment and from the consequences of their actions. The question is not whether cats can learn, but whether owners understand how cats learn, and whether owners implement training approaches that work with feline psychology rather than against it. This is part 7, and this video covers 10 behavioral and training decisions that will transform your ability to shape your cat's behavior, prevent problems before they develop, and address existing problems through methods that actually work rather than through methods that feel satisfying to frustrated owners, but that fail to change behavior. These are not the basic behavioral concepts like why cats scratch or why cats knock objects off, surfaces that we addressed in earlier content. These are the nuanced training decisions about how to respond to unwanted behavior, how to establish boundaries and rules, how to teach specific skills, and how to create household systems that prevent behavioral problems from arising in the first place. And the stakes are real, because behavioral problems are the leading cause of cats being relinquished to shelters, and the leading source of conflict between cats and their owners. Cats who scratch furniture inappropriately, who wake owners at night, who are aggressive during play, who refuse to use litter boxes, or who engage in other problem behaviors are at risk for being rehomed or for living in households where they are constantly punished and where the owner-cat relationship deteriorates into mutual frustration. These outcomes are preventable through understanding how training works and through implementing training protocols that address the underlying motivations for behavior rather than simply punishing behaviors after they occur. Let's be clear about what this video provides. This is not anthropomorphization that attributes human emotions and motivations to cats. This is not permissiveness that suggests all cat behavior should be tolerated without boundaries. This is evidence-based behavioral science that explains how cats actually learn, what training methods are effective versus what methods fail, and how to create household systems where desired behaviors are reinforced and undesired behaviors are prevented or redirected before they become established patterns. If you are new to this series, you are starting with Part 7, which assumes foundational understanding from earlier parts, including cat communication, environmental needs, and health management. Those videos are linked in the description, and while this video provides value independently, the complete series builds integrated understanding where behavioral training connects to nutrition, health, and environment as components of comprehensive cat care. Subscribe to this channel to catch the remaining parts in this series and to access the other behavioral content we produce on specific training protocols, problem-solving guides, and communication interpretation. Let's get into the comparisons that will give you the tools to train your cat effectively and to prevent the behavioral problems that create so much unnecessary conflict in cat households. Comparison 1. Positive. Reinforcement only versus balanced training. The debate about training methods in animal behavior has created two competing philosophies that are often presented as mutually exclusive and incompatible approaches: positive reinforcement only training, which uses rewards to encourage desired behaviors while avoiding any form of punishment or aversive consequences, and balanced training, which uses both rewards for desired behaviors and corrections or negative consequences for unwanted behaviors. The positive reinforcement-only movement, which has gained significant momentum in dog training and has extended into cat training discussions, positions itself as the ethical, humane approach and characterizes balanced training as outdated punishment-based methods that cause fear and damage the animal-owner relationship. The balanced training advocates argue that positive reinforcement alone is insufficient for addressing all behavioral problems, and that strategic use of appropriate corrections, when combined with positive reinforcement, produces faster, more reliable behavior change than positive reinforcement alone. This comparison examines what these training philosophies actually mean in practice, what the evidence shows about effectiveness and welfare outcomes of different training approaches, what the practical realities are when training cats specifically rather than dogs where most training research has been conducted, and how to make informed decisions about training methods based on your cat's individual temperament and on the specific behaviors you are trying to shape. Let's start with what positive reinforcement training actually involves and what the underlying principles are. Positive reinforcement training uses rewards, including treats, praise, play, or other things the cat values, to increase the frequency of desired behaviors. When the cat performs a behavior that the owner wants to encourage, the behavior is immediately followed by a reward, creating positive association between the behavior and the pleasant consequence. Through repetition, the cat learns that performing the behavior reliably produces rewards, and the behavior becomes more frequent and more consistent. The 4 quadrants of operant conditioning that underlie all training include positive reinforcement, which adds something pleasant to increase behavior, negative reinforcement, which removes something unpleasant to increase behavior, positive punishment, which adds something unpleasant to decrease behavior, and negative punishment, which removes something pleasant to decrease behavior. Positive reinforcement only training deliberately uses only one quadrant, positive reinforcement, while avoiding the other 3 quadrants that involve aversive consequences. The marker training technique using clickers or verbal markers like yes is the primary method in positive reinforcement training and allows precise communication about which exact behavior earned the reward. The marker sound occurs at the instant the desired behavior happens, followed immediately by the reward, creating clear association between the specific action and the positive consequence. This precision is particularly valuable for shaping complex behaviors or for capturing spontaneous behaviors that happen quickly. The shaping process for teaching new behaviors involves rewarding successive approximations of the desired behavior, starting with any behavior that remotely resembles what you want and gradually requiring closer approximations before rewarding. For example, teaching a cat to sit might begin by rewarding the cat for looking down at the ground, then for bending back legs slightly, then for lowering hindquarters partially, and finally for achieving full sitting position. Each step builds on the previous step until the complete behavior is established. The advantages of positive reinforcement training include creating positive associations with training sessions, so cats eagerly participate rather than avoiding training, building trust and strengthening the owner-cat relationship through positive interactions, and avoiding the fear, stress, or anxiety that punishment-based methods can create. Cats trained with positive reinforcement show enthusiasm for training and generalize learning readily to new situations because they associate the training process with positive experiences. The limitations and challenges of positive reinforcement only training appear most clearly when addressing behaviors that are self-reinforcing, meaning the behavior itself provides reward that the owner cannot control or remove. Scratching furniture provides satisfying stretch and claw maintenance that the cat experiences regardless of whether the owner rewards alternative scratching locations. Counter surfing that successfully obtains food provides powerful immediate reward that outweighs any positive reinforcement the owner might offer for staying off counters. Play aggression that results in the owner's hands moving rapidly provides exciting prey-like stimulation that is inherently rewarding to the cat. Now let's talk about balance training and what distinguishes it from positive reinforcement-only approaches. Balance training uses positive reinforcement as the primary tool, but also incorporates strategic corrections or negative consequences when positive reinforcement alone is insufficient to suppress unwanted behaviors. The corrections used in balanced cat training are typically mild and include things like interrupting unwanted behavior with a verbal no or sound, using a brief squirt from a water bottle, creating startle responses with noisemakers, or using timeouts where the cat is removed from the environment or the owner withdraws attention. The critical distinction between balance training and old-fashioned punishment-based training is that balance training uses correction strategically and minimally as supplements to primary positive reinforcement, rather than relying on punishment as the main training tool. A balanced training protocol might use positive reinforcement to teach the cat where they should scratch, while also using mild corrections to interrupt furniture scratching. When it occurs, creating both positive association with appropriate scratching and negative association with furniture scratching. The timing and consistency requirements for corrections are critical because improperly timed or inconsistent corrections do not suppress behavior and can create confusion or anxiety. The correction must occur immediately during or within seconds of the unwanted behavior, and it must occur every time the behavior happens, not sporadically. Random intermittent corrections are ineffective and create learned helplessness, where the cat cannot identify what behavior is triggering consequences. The appropriate intensity for corrections when they are used should be the minimum level necessary to interrupt the behavior, not the maximum level the owner feels the cat deserves, based on frustration with the behavior. Overcorrection creates fear that damages the relationship and that can cause behavioral problems worse than the original issue. The goal is to create a negative association strong enough to discourage the behavior without creating fear of the owner or fear of the environment. The practical reality in cat households is that many common behavior problems involve self-reinforcing behaviors, where positive reinforcement for alternatives struggles to compete with the intrinsic rewards of the unwanted behavior. Counter-surfing successfully obtaining food is so powerfully rewarding that no treat the owner can offer for remaining on the ground reliably prevents future counter-surfing. Furniture scratching feels so satisfying that even with excellent scratching posts available and positively reinforced, some cats continue choosing furniture because it feels better or is more conveniently located. Let's examine the specific situations where positive reinforcement only is clearly adequate versus situations where balanced approaches may be necessary or more effective. Positive reinforcement only is sufficient for teaching new behaviors, including tricks, commands, and skills, where no competing motivation exists. Encouraging existing desirable behaviors to occur more frequently. Creating positive associations with handling, grooming, carrier use, and other husbandry procedures. Building confidence in fearful or anxious cats where any aversive experience would worsen anxiety. Training kittens who are highly motivated by play and food rewards and who are establishing behavior patterns for the first time. Balance training may be more effective for suppressing self-reinforcing unwanted behaviors, including counter-surfing, furniture scratching, and play aggression that continue despite positive reinforcement for alternatives. Establishing firm boundaries around dangerous behaviors, including chewing electrical cords or eating toxic plants where behavior must stop immediately for safety. Addressing established problem behaviors that have been ongoing for months or years and that are deeply ingrained despite previous attempts at redirection multi-cat. Households where one cat's behavior toward another cat requires immediate intervention to prevent injury. The individual cat temperament consideration is critical because some cats respond beautifully to positive reinforcement only and never need corrections, while other cats seem to interpret the absence of consequences for unwanted behavior as permission to continue. Confident, bold cats may continue unwanted behaviors despite excellent positive reinforcement for alternatives simply because they enjoy the unwanted behavior and see no downside to continuing it. The relationship quality consideration suggests that cats with secure bonds to their owners tolerate mild corrections without relationship damage, while cats with insecure or anxious attachments may experience relationship deterioration from any correction. The owner must assess whether their individual cat will interpret a correction as clear communication about boundaries or as betrayal that damages trust. The training goals and priorities matter because if the primary goal is maintaining perfect, positive relationship and training is recreational enrichment, positive reinforcement only is appropriate. If the goal is stopping dangerous or highly disruptive behavior, balanced training that includes strategic corrections may be necessary even if it introduces mild stress, because allowing dangerous behavior to continue creates greater welfare problems than using appropriate corrections to stop it. The verdict: positive reinforcement. Only training is ideal for teaching new behaviors, for building skills and tricks, for creating positive associations, and for working with anxious or fearful cats where any aversive experience could worsen problems. It should be the first approach attempted for any behavior modification and should be the primary tool in all training protocols. Balanced training that strategically incorporates mild corrections alongside primary positive reinforcement may be necessary for suppressing self-reinforcing, unwanted behaviors that continue despite positive reinforcement for alternatives, particularly when behaviors are dangerous or when they are so disruptive that the cat's place in the household is threatened. The false dichotomy between pure positive and balanced training creates unnecessary conflict because the actual question is not whether to ever use corrections, but when corrections are necessary and appropriate, versus when positive reinforcement alone is sufficient. Most successful cat training uses primarily positive reinforcement with occasional strategic corrections for specific problems, not purely one approach or the other. If you are training your cat using positive reinforcement and it is working effectively to shape behaviors and to address problems, continue using positive reinforcement only because it is producing results without need for corrections. If you are struggling with established problem behaviors that continue despite positive reinforcement for alternatives, consider whether strategic mild corrections might interrupt the unwanted behavior enough to give the alternative behavior's opportunity to become established. Never use corrections as the primary or first response to unwanted behavior. Always establish positive reinforcement for desired alternatives first. Use corrections only when positive reinforcement has been thoroughly attempted and has been insufficient to suppress problematic behavior. And if you find yourself using corrections frequently or using increasingly intense corrections, consult with a veterinary behaviorist because the training approach is not working and professional guidance is needed to identify why behavior is not changing. Training should strengthen your relationship with your cat and should create a cat who is confident, well-adjusted, and who understands household expectations. Choose training methods that achieve these goals for your individual cat in your specific situation, rather than adhering rigidly to training philosophy that may not serve your cat's needs. Comparison 2. Free roaming kitten versus confined space for first weeks. The arrival of a new kitten into the household creates a decision point that significantly affects the kitten's adjustment period, safety, and long-term behavior development. Whether to allow the kitten immediate free access to the entire home, trusting that exploration and familiarization will proceed naturally, or whether to confine the kitten to a single room or small area initially and gradually expand access to other areas over days to weeks. The free roaming approach is appealing because it seems more humane and less restrictive, and because many owners feel guilty about confining a young animal who seems eager to explore. The confined space approach requires more patience and more active management, but is recommended by most feline behaviorists and veterinarians as producing better adjustment outcomes and as preventing problems that free roaming can create. This comparison examines what happens behaviorally and emotionally when kittens are given immediate full access versus gradual controlled access to living space, what the safety risks are of immediate free roaming versus confined introduction, how to implement confinement appropriately so it supports adjustment rather than creating stress, and how to make informed decisions about introduction protocols based on the kitten's age, temperament, and the household environment. Let's start with what happens behaviorally when kittens are given immediate free access to large, unfamiliar environments. Overwhelming sensory input is the first challenge that free-roaming kittens face when introduced to entire homes at once. Homes contain dozens of rooms, hundreds of objects, multiple floor levels, various sound sources, and constantly changing activity patterns from human occupants. For a kitten who has spent their first 8 to 12 weeks in a small contained environment, whether a cattery breeding room or a shelter cage, the sudden expansion to full house access creates sensory overwhelm that manifests as either frantic hyperactivity, as the kitten attempts to process everything simultaneously, or as fearful hiding where the kitten retreats to dark enclosed spaces and refuses to come out. The lack of secure base when kittens have access to too much space too quickly means the kitten cannot establish a reliable safe zone where they consistently return for rest, food, and security. The kitten may wander through the house unable to remember where the litter box is located, where the food bowls are, or where safe hiding spots exist, creating stress from constant uncertainty about resource locations and about which areas are actually safe versus merely accessible. The exploration-induced exhaustion occurs because kittens' natural drive to investigate pushes them to explore available space even when they are tired, hungry, or overwhelmed. A kitten with access to an entire house may spend hours investigating rather than settling to eat, rest, and adjust, creating physical exhaustion and stress that delays adjustment and that can suppress appetite and normal behavior. The hiding in inaccessible locations becomes a significant practical problem when free-roaming kittens find hiding spots under furniture, inside walls through gaps, in mechanical spaces behind appliances, or in other locations where owners cannot access them to provide care, to monitor health, or to handle for bonding. Kittens who hide for extended periods without eating or using the litter box create health risks that confined kittens avoid by being in controlled, accessible space. The litter box confusion when kittens have immediate access to multiple rooms or entire floors means the kitten may not reliably locate litter boxes when elimination urge strikes, leading to accidents in corners, under furniture, or in other locations where the kitten happens to be when the urge occurs. Litter box training depends on proximity and availability, and spreading resources too thin by expecting kittens to navigate large spaces to find boxes creates training setbacks. Now let's examine what confined space introduction provides and how it supports adjustment. Confined space protocols typically involve setting up a single room, often a bedroom or bathroom, with all essential resources including litter box, food and water bowls, scratching post, toys, and comfortable sleeping areas. The kitten remains in this room continuously for the first few days to 2 weeks, depending on adjustment speed, before gradually receiving supervised access to adjacent areas and eventually to the full home. Over additional weeks, the manageable sensory environment that single-room confinement provides allows the kitten to process sights, sounds, smells, and activity at appropriate pace without being overwhelmed. The limited space contains predictable, consistent elements that the kitten can learn quickly, establishing confidence and security that serves as foundation for exploring additional space later. The resource location learning happens rapidly when everything the kitten needs is contained in small, visible area. Within hours of arrival, the kitten learns exactly where the litter box is located, where food is always available, and where safe sleeping spots exist. This reliable knowledge eliminates anxiety about resource access and supports normal eating, elimination, and rest patterns from the first day. The forced rest and regulation occurs naturally when the kitten's exploration drive is satisfied by thoroughly investigating the limited space available. After investigating every corner, toy, and surface in the room within the first hours, the kitten settles into normal patterns of eating, playing, grooming, and sleeping, rather than continuing frantic exploration because there is nothing left to investigate. This settling allows normal adjustment rather than sustained hyperarousal. The bonding opportunity through concentrated interaction is enhanced when the kitten is in confined space where owner visits are frequent and where the owner is the primary source of stimulation and enrichment. The kitten associates owner presence with positive interaction, and the owner has access to handle, play with, and socialize the kitten without the kitten disappearing into inaccessible areas. This creates stronger early bonding than occurs when free-roaming kittens spend most of their time exploring independently. The health monitoring capability when kittens are confined allows owners to verify that the kitten is eating adequately, drinking water, urinating and defecating normally, and showing no signs of illness or distress. Changes in appetite, litter box use, or activity level are immediately apparent in confined space. While they may be missed for days when kittens have full house access and their activities are distributed across multiple areas, the safety advantages of confinement are substantial and include preventing access to hazards, including electrical cords, toxic plants, small objects that could be swallowed, spaces where the kitten could become trapped, and opportunities to escape through doors or windows that might be opened briefly. The controlled environment eliminates risks that exist in homes that are not perfectly kitten-proofed. Let's address the specific protocols for implementing confined space introduction correctly. The room selection should prioritize owner bedroom if possible, because bedroom confinement allows nighttime proximity where kitten vocalizations are heard and responded to appropriately, and where owner presence during sleep hours provides security for the kitten who is adjusting to separation from mother and littermates. Bathrooms work when bedrooms are unavailable but provide less comfortable sleeping space and less social proximity. The resource placement within the confined room should separate litter box from food bowls by maximum distance the room allows, because cats naturally prefer separating elimination areas from eating areas. Scratching post should be placed near sleeping areas because cats naturally scratch after waking. Toys should be scattered throughout room to encourage movement and investigation. Hiding spots, including cardboard boxes or cat tunnels, should be provided but should be accessible to owner for retrieval if needed. The duration of confinement varies by individual kitten adjustment, but typically ranges from 3 to 7 days for confident, bold kittens who quickly establish security in the room, to 10 to 14 days for timid or fearful kittens who need longer periods to build confidence before facing additional space. The indicators of readiness for expansion include confident movement throughout the room, consistent eating and litter box use, playful engagement with owner and greeting owner at door, rather than hiding when owner enters. The expansion protocol proceeds gradually by allowing supervised short visits to adjacent rooms, while keeping the original confinement room as home base, where the kitten returns for meals and for overnight periods. Days to weeks, supervised access expands to more rooms until the kitten has familiarized with the entire home while maintaining confidence and orientation throughout. The verdict. Confined space introduction for the first days to 2 weeks after bringing a kitten home provides better adjustment outcomes, better safety, better bonding opportunities, and better health monitoring compared to immediate free-roaming access that overwhelms many kittens and creates adjustment problems. Free-roaming introduction may work acceptably for exceptionally confident, bold kittens in very small homes where the entire environment is essentially one visible space. But even in these situations, confined space introduction provides advantages without creating problems, making it the safer choice. The guilt that owners feel about confining kittens is based on anthropomorphization that attributes human desires for maximum freedom to animals, whose needs are actually for security, manageable stimulation, and gradual familiarization. The kitten confined to appropriate space with proper resources is not suffering, but is adjusting comfortably, while the kitten given overwhelming access is often stressed despite appearing to owners like they are enjoying freedom. If you are bringing home a new kitten, set up a single room with all resources before the kitten arrives, confine the kitten to this room for at least the first 3 to 5 days, regardless of how eager the kitten seems to explore beyond, and expand access gradually based on the kitten's demonstrated confidence and security, rather than rushing expansion because you feel bad about confinement. The investment of 1 to 2 weeks of confinement and gradual expansion creates a confident, well-adjusted cat who knows their entire home, who reliably uses resources, and who is bonded strongly with owners. The shortcuts of immediate free roaming often create problems that take months to resolve and that could have been prevented through patient-appropriate introduction protocol. Comparison. 3. Allow furniture versus off-limits training. The question of whether cats should be allowed on furniture, including couches, beds, tables, and counters, is one of the most common household boundary decisions that cat owners face, and the answer varies dramatically between households based on personal preferences, cleanliness standards, safety considerations, and practical realities of enforcement. Some households embrace cats on all furniture as part of sharing living space with feline family members, creating environments where cats have unrestricted access to sleep on beds, sit on couches, and even walk on dining tables and kitchen counters. Other households establish firm boundaries where certain furniture is completely off limits, training cats to remain on floor level or on designated cat furniture while avoiding human furniture entirely. The decision reflects values about cleanliness, about appropriate human-animal boundaries, about practical considerations like allergen management and furniture wear, and about the owner's willingness to enforce boundaries consistently when cats naturally prefer elevated surfaces and when preventing access to furniture requires ongoing management. This comparison examines what drives furniture access preferences in different households, what the practical implications are of allowing versus restricting furniture access, how to train off-limits boundaries effectively when they are chosen, and how to make informed decisions about furniture rules based on your household situation and your cat's needs. Let's start with what allowing furniture access means in practice and what the advantages and disadvantages are. Unrestricted furniture access means cats are welcome on all furniture at all times, without boundaries or training, to keep them off specific pieces. Cats choose where to rest based on their preferences, which typically means gravitating toward warm, comfortable, elevated surfaces, including beds, couches, armchairs, and sunny windowsills. The cats may also access counters, tables, and other surfaces during exploration or during attempts to reach high storage areas or windows. The bonding advantage of allowing cats on furniture is that cats who sleep on their owners' beds or sit beside owners on couches have more physical proximity and more shared resting time than cats who are kept off furniture. The physical closeness during sleep or during relaxation creates bonding, opportunities that floor-restricted cats miss. Many cat owners report that some of their most meaningful interactions with their cats occur during shared bedtime or during relaxed couch time, where cat and owner are comfortable together. The cat comfort and preference consideration is that cats naturally prefer elevated resting locations that provide visual surveillance of their territory, thermal comfort from sunlight or heating sources that tend to be near furniture, and soft supportive surfaces that furniture provides compared to floors. Allowing furniture access aligns with natural feline preferences and provides better quality resting opportunities than expecting cats to remain on floor-level cat beds that are often in less desirable locations. The practical challenges of allowing furniture access include fur accumulation on surfaces where people sit and sleep, requiring frequent cleaning to maintain acceptable cleanliness. Shedding cats leave visible fur on dark furniture, and even light-shedding cats accumulate enough fur over days to weeks that furniture cleaning becomes necessary. Scratching damage is possible on fabric furniture if the cat is not well trained to use scratching posts, and some cats who are allowed on furniture develop scratching behaviors on upholstery that cause permanent damage. The allergen management issue becomes significant for households with cat-allergic members or guests because cat allergens concentrate on furniture surfaces where cats rest, and removing allergen from fabric furniture is difficult even with thorough cleaning. Keeping cats off furniture, particularly beds, reduces allergen exposure for allergic individuals and improves symptom management compared to allowing cats on all furniture. The hygiene consideration that concerns some owners is that cats who use litter boxes and who walk through litter necessarily track small amounts of litter and waste on their paws. And when those cats walk on counters, dining tables, or food preparation surfaces, there is potential for fecal contamination even if the risk is low. While cats are relatively clean animals who groom extensively, the potential for contamination is real enough that many households prefer keeping cats off surfaces where food is handled. Now let's talk about off-limits training and how it works when furniture restrictions are chosen. Off-limits training uses consistent interruption of unwanted behavior, combined with positive reinforcement for staying off restricted surfaces to teach cats that specific furniture is not accessible. The training typically targets the highest priority surfaces, including kitchen counters, dining tables, and sometimes beds, while allowing access to less problematic furniture like couches and armchairs. The interruption techniques for cats on restricted surfaces include verbal no or AA sounds, clapping hands, using compressed air cans to create startling noise, or gently physically removing the cat from the surface while redirecting to appropriate alternatives. The interruption must occur immediately when the cat jumps onto the restricted surface, and it must occur every time for consistency to establish that the surface is reliably off limits rather than sometimes accessible. The environmental deterrents work when the owner cannot directly supervise and include placing sticky tape on counter edges that cats dislike touching, using motion-activated compressed air sprays that activate when the cat approaches counters, or placing aluminum foil on surfaces that creates unpleasant texture cats avoid. These tools create negative associations with the surface itself rather than with the owner's presence, reducing the risk that cats only avoid surfaces when owner is present while accessing them freely when owner is away. The alternative provision is critical for off-limits training success because cats need elevated resting spots, and if furniture is restricted without providing alternatives, the cat experiences deprivation of natural needs. Tall cat trees, wall-mounted shelves, and window perches in desirable locations provide the elevated access and visual surveillance that furniture provides, allowing the cat to satisfy preferences without violating household boundaries. The consistency requirement is absolute for effective off-limits training because inconsistent enforcement teaches cats that furniture is sometimes accessible, creating persistent testing behavior where cats repeatedly attempt to access furniture, hoping the rule has changed. If any household member allows the cat on furniture even occasionally, the training fails because the cat learns that persistence sometimes succeeds. The practical limitations of off-limits training include the reality that many cats are only deterred from furniture when owners are present, and they freely access restricted surfaces when alone or when owners are sleeping. This makes enforcement difficult in multi-level homes or in situations where the cat can access restricted surfaces when the owner is at work. Complete restriction of furniture access requires either perfect environmental deterrents that work 24/7 or acceptance that some violations will occur when supervision is absent. Let's examine the specific situations where allowing furniture versus restricting access is clearly preferable. Allowing furniture access is preferable when allergen concerns are absent and no household members have cat allergies. Furniture is selected for durability and is not precious or fragile. The bonding benefits of shared furniture time are valued highly. Cleaning fur from furniture is not burdensome. The cat has never shown furniture scratching problems. Litter box hygiene is excellent and paw tracking is minimal. Restricting furniture access is preferable when Household members have cat allergies requiring allergen reduction strategies. Furniture is expensive, delicate, or precious, and damage risk is unacceptable. Hygiene standards require keeping cats off food preparation surfaces and dining areas. The cat has destructive scratching tendencies that damage upholstery. Multiple cats create excessive fur accumulation that is difficult to manage. Personal preference strongly favors clear boundaries between human and animal spaces. The middle ground approach, where some furniture is allowed while other furniture is restricted, is common and practical. Many households allow cats on couches and personal beds, while training cats to stay off kitchen counters, dining tables, and food preparation surfaces where hygiene concerns are highest. This compromise provides cats with comfortable, elevated resting spots while maintaining boundaries where they matter most for health and cleanliness. The verdict, allowing furniture access versus training off-limits boundaries, is a personal preference decision that should be based on household members' allergen sensitivity, hygiene priorities, furniture value and durability, and willingness to manage fur and to enforce boundaries consistently. Neither approach is inherently superior for cat welfare if alternatives are provided when furniture is restricted, because cats can be perfectly content with cat trees and shelves as elevated resting spots without needing access to human furniture. The decision should be made deliberately based on actual household priorities rather than by default where cats access furniture simply because no training was attempted, or where furniture restrictions are inconsistently enforced, creating ongoing conflict. If you value the bonding opportunities of sharing furniture with your cat and the practical concerns of fur, allergens, and hygiene are manageable, allowing furniture access enhances your relationship without creating significant problems. Provide washable furniture covers and maintain regular cleaning to manage fur accumulation. If allergen management, furniture protection, or hygiene standards require restricting access, implement consistent off-limits training, starting when the cat is young if possible. Use environmental deterrents for surfaces that cannot be supervised, and provide excellent alternatives including tall cat trees and window perches that satisfy the cat's need for elevated access. The worst approach is inconsistent enforcement, where the cat sometimes receives access and sometimes receives correction, creating confusion and persistent testing behavior. Make clear household rules, enforce them consistently, and provide appropriate alternatives when restrictions are imposed. Your cat will adapt to whatever boundaries you establish as long as they are consistent, clear, and accompanied by positive alternatives. Comparison 4. Consistent rules versus flexible boundaries. The household management approach to cat behavior rules creates a fundamental tension between the behavioral science principle that consistent, predictable boundaries produce best training outcomes and reduce anxiety and the human tendency toward flexibility that accommodates mood, circumstances, and individual situations that seem like they merit exceptions to rules. The consistent rules approach establishes clear boundaries that apply universally, regardless of context, time of day, or human mood, operating on the principle that cats learn most effectively when consequences are reliable and when behavioral expectations do not shift based on variables the cat cannot predict. The flexible boundaries approach recognizes that life is complex, that rigid rules sometimes conflict with practical realities or special circumstances, and that occasional exceptions to rules are inevitable and manageable as long as they are not so frequent that they undermine the rules entirely. This comparison examines what the research shows about how consistency versus variability in rule enforcement affects cat behavior and learning, what the practical realities are in multi-person households where different members may have different standards, how to determine which rules genuinely require strict consistency versus which can tolerate flexibility, and how to make informed decisions about household rule structures that serve both effective training and practical livability. Let's start with what behavioral science tells us about consistency in rule enforcement and learning. Consistent consequences for behaviors create the clearest learning because the cat can reliably predict that specific actions produce specific outcomes. If jumping on counters always results in interruption and redirection, the cat learns that counters are off limits and reduces or eliminates counter jumping. If begging at dinner table never results in receiving food, the cat learns that begging is ineffective and extinguishes the behavior. The predictability allows the cat to adjust behavior to avoid negative consequences and to perform behaviors that produce positive consequences. Variable ratio reinforcement, which is when behaviors are rewarded or punished unpredictably rather than consistently, creates the strongest resistance to extinction and the most persistent behavior. If counter jumping sometimes goes uncorrected and sometimes results in correction, the cat learns that persistence sometimes succeeds, creating behavior that is extremely difficult to extinguish because the intermittent success provides powerful motivation to keep trying. If begging sometimes results in receiving treats and sometimes results in being ignored, the begging behavior becomes more frequent and more persistent rather than less, because the unpredictable rewards create gambling-like motivation where the cat cannot predict when the next payoff will occur. The slot machine effect describes this phenomenon and explains why inconsistent rule enforcement creates exactly the opposite of intended effect. Owners who sometimes give in to begging or who sometimes allow rule violations are not being kind or flexible. They are creating the behavioral equivalent of slot machines that pay out unpredictably, training the cat to persist with unwanted behaviors because occasional success is more powerful at maintaining behavior than consistent reinforcement or consistent non-reinforcement. The anxiety and confusion that inconsistent rules create is often overlooked by owners who think flexibility is kinder than rigid consistency. Cats who cannot predict whether specific behaviors will be accepted or corrected experience ongoing uncertainty about behavioral expectations, which manifests as anxiety, hypervigilance about owner mood and reactions, and reduced confidence in their understanding of household rules. Consistent rules, even when they are restrictive, create security because the cat knows exactly what is expected and can confidently navigate the environment without constant uncertainty. The multi-person household challenge magnifies inconsistency problems because different household members often have different standards and different enforcement consistency. One person strictly enforces the no counter-jumping rule while another person ignores counter-jumping, or one person never allows begging while another person occasionally gives in. The cat experiences contradictory consequences from different people for the same behavior, creating confusion and creating behavior that is difficult to manage because the cat learns that rules depend on which human is present. Now let's examine the situations where flexibility might seem necessary and whether exceptions actually serve any purpose or whether they simply undermine training. Special circumstances that tempt owners toward flexibility include situations like visitors, being present where the owner feels embarrassed to correct the cat, holidays or celebrations where the owner wants to be lenient, the cat seeming especially needy or upset, or the owner being tired or stressed and not wanting to enforce rules. The rationalization is that occasional exceptions during special circumstances will not undermine overall training as long as normal rules resume afterward. The reality is that cats do not understand special circumstances. The cat, who is allowed to beg at the table during Thanksgiving dinner, does not interpret this as a one-time exception. The cat learns that begging at the table sometimes works, and the behavior increases rather than remaining limited to special occasions. The cat who is allowed to wake the owner at 5 a.m. on weekends because the owner feels bad about being at work all week during weekdays learns that weekend morning waking sometimes succeeds, making the behavior more persistent on both weekdays and weekends. The slippery slope of exceptions is that each exception makes the next exception easier to justify, and what begins as occasional flexibility in special circumstances gradually erodes into inconsistent enforcement, where the rule exists in theory, but is violated frequently in practice. The owner, who occasionally gives in to begging when the cat seems particularly insistent, begins giving in more frequently until the rule against begging exists primarily in the owner's mind, while the cat experiences regular reinforcement for begging. The practical realities that create pressure toward flexibility include multiple household members with different standards, household guests who may not follow house rules, situations where enforcing rules is inconvenient or embarrassing, and owner fatigue that makes consistent enforcement feel burdensome. These pressures are real, but accommodating them through flexible boundaries trades short-term convenience for long-term behavioral problems that are more difficult to resolve than maintaining consistency would have been. Let's address which household rules genuinely require absolute consistency versus which might tolerate occasional flexibility. Rules requiring absolute consistency. Behaviors that are dangerous, including chewing electrical cords, eating toxic plants, or approaching hot stoves, must receive immediate consistent interruption. Every time litter box use must be consistently reinforced and never punished in any context. Aggression toward humans or other pets must receive consistent immediate response every time to establish that aggression is never acceptable. Food begging where even occasional success creates persistent problematic behavior. Nighttime waking where even occasional response reinforces the behavior and makes it more frequent. Rules where occasional flexibility creates minimal problems. Access to specific sleeping spots where the cat sometimes being allowed on a usually restricted surface does not create safety issues or hygiene concerns. Play rules where slightly rougher play is sometimes tolerated during particularly energetic play sessions. Furniture access where exceptions during thunderstorms or stressful events acknowledge legitimate security needs. The critical distinction is that flexibility that acknowledges legitimate cat needs, including seeking security during genuinely frightening events, is different from flexibility that reinforces behavior patterns the owner wants to discourage. Allowing a cat to sleep on the bed during a thunderstorm acknowledges fear-driven security seeking and does not meaningfully reinforce general bed access-seeking behavior. Allowing a cat to beg at the table during a special meal reinforces begging behavior generally and makes the problem worse. The verdict, consistent rules that are enforced predictably every time produce better training outcomes, less anxiety, and more confident cats who understand household expectations compared to flexible boundaries where rules are enforced inconsistently based on circumstances or mood. The temporary convenience or emotional satisfaction of occasionally giving in to unwanted behaviors creates long-term behavioral problems that are more difficult to resolve than the inconvenience of maintaining consistency would have been. Multi-person households must establish clear agreements about household rules and must enforce rules consistently across all household members to avoid the confusion and persistent problematic behavior that contradictory enforcement creates. Rules regarding dangerous behaviors, begging, nighttime waking, and other self-reinforcing behaviors require absolute consistency because even occasional success reinforces behavior more powerfully than consistent failure. If you currently have inconsistent rule enforcement, where different people enforce different standards, or where you sometimes allow behaviors you generally want to discourage, recognize that you are training the behaviors to persist rather than training them to stop. Establish clear household rules, gain agreement from all household members about enforcement, and commit to consistent enforcement even when it is inconvenient. If you feel that rigid consistency is unkind or too strict, understand that the inconsistency that seems kinder is actually creating anxiety and confusion for your cat, who cannot predict behavioral expectations. Consistent rules, even restrictive ones, create security that flexible boundaries cannot provide. Train once with consistency rather than training constantly against persistent behaviors that inconsistency has made resistant to extinction. Your cat and your household will be calmer and more harmonious when everyone knows the rules and when the rules are reliable. Comparison 5. Timeout versus redirection for discipline. When cats engage in unwanted behaviors including play aggression, excessive vocalization, destructive scratching, or other problematic actions, owners must choose how to respond in ways that discourage the unwanted behavior without damaging the cat's trust or creating fear. Two common discipline approaches are timeouts, where the cat is removed from the situation or isolated briefly following unwanted behavior, and redirection, where the cat's attention and behavior are guided toward acceptable alternatives when unwanted behavior occurs. The timeout approach borrows from child discipline methods and operates on the principle that removing access to interaction or environment following bad behavior teaches that the behavior has negative consequences. The redirection approach focuses on interrupting unwanted behavior and immediately providing appropriate outlets for the underlying motivation, teaching what the cat should do, rather than only punishing what they should not do. This comparison examines when each approach is appropriate, how to implement them correctly to maximize effectiveness and minimize stress. What the research and clinical experience show about outcomes from different discipline methods with cats, and how to choose discipline strategies based on the specific unwanted behavior and on your cat's temperament. Let's start with timeouts and what they involve. Timeout protocols for cats typically involve either removing the cat from the room where unwanted behavior occurred and placing them in a separate room alone for 5 to 15 minutes, or the owner leaving the room and closing the door while the cat remains, withdrawing social access as consequence for unwanted behavior. The timeout is implemented immediately after unwanted behavior occurs, and it is intended to create association between the behavior and loss of positive interaction or access. The theoretical mechanism behind timeouts is negative punishment in operant conditioning terms, where something desirable, social interaction, environmental access, is removed to decrease unwanted behavior. The cat learns that specific behaviors result in isolation or in loss of interaction, and ideally reduces those behaviors to avoid the negative consequence. The practical challenges with timeouts for cats include the cat often not understanding what caused the timeout, particularly if there is any delay between behavior and consequence. Cats have very short windows for associating consequences with behaviors, typically 1 to 3 seconds, and any delay beyond this window means the cat cannot reliably learn which behavior triggered the timeout. The play aggression context is where timeouts are most commonly recommended and where they can be effective. When cats bite or scratch during play, immediately ending play and leaving the room teaches that rough play results in loss of playtime. This works because the consequence, loss of play, is directly related to the behavior, play aggression, and because play is highly valued by most cats, making its removal an effective negative consequence. The inappropriate timeout uses include using timeouts for behaviors that are not attention-seeking or that are self-reinforcing, where isolation provides no consequence because the cat did not want interaction anyway. Putting a cat in timeout for counter-surfing when the cat already obtained food does nothing to address the behavior because the primary reinforcement, food, already occurred before the timeout. Timeouts for fear-based behaviors or for litter box accidents are actively harmful because they punish cats for behaviors driven by anxiety or medical issues rather than by choice. Now let's examine redirection and how it works. Redirection involves interrupting unwanted behavior and immediately providing an appropriate alternative outlet for the motivation driving the behavior. If the cat is scratching furniture, redirection involves stopping the scratching and immediately guiding the cat to a scratching post. If the cat is biting during play, redirection involves stopping play momentarily, then resuming play with a toy rather than hands. The focus is on teaching what to do, rather than only punishing what not to do. The advantages of redirection include that it provides the cat with information about acceptable behavior, rather than only creating negative associations with unwanted behavior. The The cat learns both that furniture scratching is interrupted and that scratching post-use is encouraged, creating clear behavioral alternatives. Redirection is also more forgiving of imperfect timing, because even if interruption is slightly delayed, guiding the cat to the appropriate alternative still teaches the desired behavior. The play aggression redirection is particularly effective and involves stopping play immediately when biting or scratching occurs, waiting 30 to 60 seconds for arousal to decrease, then resuming play with a toy that allows the cat to chase and pounce without using owner's hands. This teaches that rough play on human body parts stops play, while appropriate toy-directed play continues, creating clear discrimination about what is acceptable. The scratching redirection requires having scratching posts available near furniture that the cat targets, so redirection can happen immediately by moving the cat from furniture to post. Positive reinforcement, including treats or praise when the cat uses the post after redirection, strengthens the alternative behavior and increases likelihood that the cat chooses the post independently in future. The limitations of redirection include that it requires owner presence and immediate response, making it ineffective for managing behaviors that occur when the owner is not home or cannot supervise. Redirection also does not work well for behaviors that are internally rewarding, regardless of alternatives, where the cat prefers the unwanted behavior even when alternatives are provided. Let's address which discipline approach is appropriate for specific unwanted behaviors. Timeouts are appropriate for play aggression, where biting or scratching humans occurs during interactive play, attention-seeking behaviors including excessive vocalization directed at owner or pestering for food, when feeding time is not near bullying behaviors between cats where one cat harasses another and social interaction is the motivator. Any behavior where the primary reward is access to owner attention or interaction. Redirection is appropriate for scratching inappropriate surfaces where acceptable alternatives exist, chewing or biting objects where appropriate chew toys can be provided, play behaviors that need to be directed toward toys rather than toward humans or inappropriate items. Investigative behaviors where curiosity drives the action and can be redirected to acceptable outlets. Neither timeout nor redirection is appropriate for litter box, accidents driven by medical issues or anxiety, fear-based behaviors including hiding, hissing, or defensive aggression, behaviors driven by medical problems including excessive grooming from skin issues or vocalization from pain, instinctive behaviors including hunting prey animals where discipline is inappropriate. The verdict. Timeouts and redirection serve different purposes and are appropriate for different situations rather than being universally better or worse. Timeouts work for attention-seeking behaviors where social access is the primary reward, while redirection works for behaviors driven by instincts including scratching, hunting, and play that need appropriate outlets. The most effective discipline strategies combine both approaches where appropriate, using timeout to end unwanted interaction-based behaviors, and using redirection to teach acceptable alternatives for instinct-driven behaviors. Never use timeouts as primary response to behaviors without understanding whether the behavior is actually attention-seeking or whether it serves other purposes, where isolation provides no meaningful consequence. Always provide and reinforce acceptable alternatives when redirecting, because interrupting unwanted behavior without teaching what is acceptable creates frustration without solving problems. If your discipline approach is not changing behavior after consistent implementation for 2 weeks, you are likely using the wrong approach for the specific behavior. Reassess whether the behavior is attention-seeking, use timeout, instinct-driven, use redirection, or caused by medical or environmental problems. Address the underlying cause rather than disciplining. Discipline should teach your cat household expectations while maintaining your relationship. Choose methods that communicate clearly about boundaries while respecting your cat's motivations and needs. Comparison 6. Carrier training. Gradual versus quick desensitization. The cat carrier is one of the most feared objects in many cat households, triggering panic responses where cats hide, flee, or fight vigorously to avoid being placed in carriers that they associate exclusively with stressful veterinary visits or travel. This carrier phobia creates practical problems when veterinary care is needed and creates unnecessary stress for both cats and owners during the struggle to confine panicked cats who are desperate to escape. The solution is carrier training that creates positive or neutral associations with carriers, so cats willingly enter and remain calm during transport. The question is whether to use gradual desensitization protocols that build positive associations slowly over weeks to months, or whether to use quick desensitization methods that compress the training timeline into days when immediate carrier use is needed. This comparison examines what gradual and quick desensitization protocols involve, when each approach is appropriate, how to implement each method correctly, and how to choose training approaches based on whether carrier use is immediately necessary or whether training can proceed without time pressure. Let's start with gradual desensitization and why it is considered the gold standard for carrier training. Gradual desensitization protocols involve making the carrier a permanent fixture in the living environment, rather than an object that only appears before stressful events, building positive associations through feeding and play near and inside the carrier, and progressing through small incremental steps from carrier exposure to voluntary entry to remaining calm while confined. Phase 1. Environmental integration begins by placing the carrier in a high-traffic area where the cat spends time, removing the door so the carrier is an open, cave-like structure rather than a trap, and making the interior comfortable with soft bedding and familiar scents. The carrier remains in place continuously, becoming a neutral part of the environment that the cat can investigate without pressure. Phase 2. Positive associations involves placing treats, meals, or favorite toys inside the carrier to create positive experiences associated with the carrier's presence and interior. Feeding meals near the carrier and gradually moving the food bowl inside builds association between eating, highly positive, and carrier presence. Play sessions with wand toys that involve the cat running into and out of the carrier create playful, positive interactions with the space. Phase 3. Voluntary entry happens naturally as positive associations build, and the cat begins choosing to rest in the carrier or to investigate it during play without any coercion. When voluntary entry is established, the training moves to closing the door briefly while the cat is inside eating or resting, then immediately reopening before anxiety develops. Phase 4. Confined calm gradually increases duration of doctor closure while maintaining calm behavior through distraction with treats, through gentle talking, and through keeping sessions short enough that anxiety does not build. The progression goes from seconds to minutes over days to weeks, building tolerance for confinement without creating stress. Phase 5. Movement and transport introduces carrying the closed carrier short distances inside the home, then progressing to car travel for very short distances to positive destinations if possible, or simply returning inside if positive destinations are not available. The goal is teaching that carrier confinement sometimes involves movement, but that movement does not always mean stressful destinations. The timeline for gradual desensitization typically requires 4 to 8 weeks for most cats to progress from carrier fear to comfortable voluntary entry and calm confinement, with some cats requiring longer depending on severity of initial fear and on consistency of training. The timeline is incompatible with situations where immediate carrier use is needed for urgent veterinary care or for required travel. Now let's examine quick desensitization and when compressed timelines are necessary. Quick desensitization protocols compress the training timeline into days rather than weeks through more intensive training sessions. Through using higher value rewards and through progressing through steps faster while accepting higher stress levels than gradual protocols allow. Quick desensitization is used when veterinary appointments or travel cannot be delayed for the weeks that gradual training requires. The intensive training approach involves multiple daily training sessions rather than one daily session, with each session progressing further through the desensitization steps than gradual protocols would attempt. A quick desensitization protocol might progress from carrier introduction to voluntary entry to brief door closure all within the first day, compared to gradual protocols that might spend days or weeks on each phase. The high-value reward strategy uses extremely desirable treats or foods that the cat rarely receives at other times, creating powerful positive associations with carrier training sessions that build acceptance faster than lower-value rewards. Canned tuna, cooked chicken, or squeeze tube treats are typical high-value rewards used in quick desensitization. The stress tolerance acceptance is the critical difference between gradual and quick desensitization. Gradual protocols keep stress below threshold throughout training, preventing anxiety and maintaining purely positive associations. Quick protocols accept that some anxiety will occur during training because the compressed timeline prevents complete anxiety avoidance, but stress is managed and kept below panic levels while progressing through necessary training steps. The practical reality is that quick desensitization produces carrier tolerance, adequate for functional use, but does not create the truly positive carrier associations that gradual training produces. A cat trained through quick desensitization may willingly enter the carrier with encouragement and may tolerate confinement without panic, but likely does not choose to rest in the carrier spontaneously the way cats trained through gradual methods often do. Let's address the specific situations where each approach is appropriate. Gradual desensitization is appropriate when no immediate carrier need exists and training can proceed without time pressure. The cat has severe carrier phobia from previous traumatic experiences. Building completely positive associations is the goal to eliminate all carrier fear. Long-term multiple uses of the carrier are anticipated, where investment in thorough training pays off over time. The owner has time and motivation to implement consistent daily training over weeks. Quick desensitization is necessary when a veterinary appointment is scheduled within days or weeks and cannot be delayed. Travel is imminent and carrier use is required on a fixed timeline. Emergency veterinary care revealed the need for better carrier training, and next appointment is approaching. The cat has never been carrier trained, and immediate functional tolerance is needed. The owner is unwilling or unable to commit to weeks of gradual training. The combination approach where quick desensitization is used to achieve functional carrier tolerance for an immediate need, followed by continuing gradual training afterward to improve associations and reduce stress for future uses, provides practical solution for situations where both immediate use and long-term improvement are goals. The emergency carrier loading for cats who are completely untrained and who need immediate veterinary care involves using towel wrapping or scruffing techniques that humanely confine panicked cats for essential care while minimizing injury risk to cat and owner. These techniques are not training and are not ideal, but they are sometimes necessary when health requires immediate transport and when no trained alternative exists. The verdict: gradual desensitization over 4 to 8 weeks is the superior training method when time allows, producing truly positive carrier associations that eliminate fear and that create cats who voluntarily use carriers as comfortable resting spots. The time investment pays dividends over the cat's lifetime through stress-free veterinary visits and travel. Quick desensitization compressed into days is necessary when immediate carrier use cannot be delayed. And while it produces adequate functional tolerance, it does not create the positive associations that gradual training produces. The trade-off is accepting higher stress during training and less complete fear elimination in exchange for meeting time requirements. If you do not currently need carrier use immediately, begin gradual desensitization training now before need arises. Leave the carrier out as furniture, feed meals inside it, and build positive associations so that when veterinary care is eventually needed, the carrier is not a source of panic. If you need carrier use within days or weeks, implement quick desensitization immediately using high-value rewards and intensive training sessions, accepting that some stress will occur, but managing it below panic levels while building functional tolerance. Never wait until the morning of a veterinary appointment to attempt carrier loading for an untrained cat. The panicked struggle that results creates trauma that worsens carrier fear and makes future training more difficult. Invest in training before crisis need arises, or use quick desensitization when you first schedule appointments rather than waiting until departure time. Carrier training is one of the highest value training investments you can make for your cat's welfare, eliminating the stress of forced confinement and making essential veterinary care possible without traumatic struggle. Choose the training timeline that matches your situation and commit to completing the training rather than perpetuating carrier phobia through continued neglect of this essential skill. Comparison 7. Bathing cats. Never versus occasionally. The question of whether cats should ever be bathed is contentious in cat care discussions, with strong opinions on both sides, ranging from categorical rejection of bathing as unnecessary and stressful interference with natural self-grooming, to acceptance of occasional bathing for specific situations where grooming alone is insufficient. The never bathe position emphasizes that cats are fastidious self-groomers who maintain coat cleanliness without human intervention, that bathing strips natural oils from skin and coat, causing dryness and irritation, and that the stress of bathing outweighs any hygiene benefit for healthy cats. The occasional bathing position recognizes that specific situations, including exposure to toxic substances, severe flea infestations, medical conditions affecting grooming ability, or preparation for showing, create legitimate needs for bathing that self-grooming cannot address. This comparison examines what cats' natural grooming capabilities are and when they are adequate versus insufficient, what happens to skin and coat when bathing occurs, how to determine when bathing is genuinely necessary versus unnecessary interference, and how to implement bathing correctly when it is needed to minimize stress and maximize effectiveness. Let's start with cats' natural grooming and why it is usually sufficient for cleanliness. Feline grooming behavior involves licking coat with the tongue's backward-pointing papillae that act as natural combs, removing loose fur, distributing skin oils throughout the coat for waterproofing and shine, and removing dirt and debris. Cats spend 30 to 50% of waking hours grooming, making it one of their primary maintenance activities. The saliva contains cleaning enzymes that break down oils and dirt, providing mild cleaning action beyond simple mechanical removal. The natural oil balance in cat skin and coat provides waterproofing, insulation, and protection against environmental irritants. The sebaceous glands at hair follicle bases secrete sebum that coats each hair, creating glossy appearance and providing barrier protection. Frequent bathing removes these oils faster than the skin can replace them, leaving coat dry, dull, and more vulnerable to matting and to skin irritation. The stress factor of bathing is significant for most cats who have not been trained from kittenhood to tolerate water exposure. The restraint required to bathe struggling cats, the sensory overwhelm from water temperature and pressure, the unfamiliar sensations of wetness and of being handled during vulnerable wet state, and the extended duration of drying all create stress that affects cats' well-being beyond the immediate bathing event. The exceptions where self-grooming is insufficient include elderly or arthritic cats, who can no longer reach all body areas to groom effectively, obese cats who cannot physically reach their hindquarters, cats with medical conditions, including hyperthyroidism that cause oily seborrhea and matted coat, cats exposed to toxic substances that must be removed before the cat ingests them through grooming, and long-haired breeds where severe matting occurs despite regular brushing. Now let's examine the specific situations where bathing is genuinely necessary versus where it is optional or harmful. Medically necessary bathing occurs when the cat has been exposed to toxic substances, including motor oil, antifreeze, household chemicals, or toxic plants, where residue on the coat could be ingested during grooming and cause poisoning. Immediate bathing to remove the substance before the cat grooms is essential life-saving intervention that justifies the stress. Severe flea infestations, where topical preventive treatments alone are insufficient, may require bathing with flea shampoos to kill adult fleas and remove flea dirt, flea feces, that contributes to skin irritation. This is increasingly rare with modern effective topical preventives, but it remains a legitimate medical indication for bathing when infestations are overwhelming. Medical skin conditions including seborrhea, fungal infections, or bacterial skin infections may require medicated baths as part of veterinary treatment protocols. The shampoos contain active ingredients that treat the underlying condition, and bathing frequency and duration are prescribed by veterinarians based on specific diagnosis. These are medical treatments rather than routine grooming. Show preparation for cats who will be exhibited requires bathing to meet show standards for coat presentation, and show cats are typically trained from kittenhood to tolerate bathing as part of their conditioning for the show environment. This is elective grooming that serves human interests in competition rather than cat needs for cleanliness. Unnecessary bathing includes routine bathing of healthy cats who groom normally. Bathing because the owner feels the cat looks dirty when the coat is actually clean and healthy. Bathing with scented shampoos because the owner wants the cat to smell like perfume rather than like cat. And bathing to reduce shedding when regular brushing provides the same benefit without the stress or oil disruption that bathing causes. Let's address how to bathe cats correctly when bathing is determined to be necessary. The preparation steps include gathering all supplies before beginning, so the process can proceed quickly without leaving the cat unattended while wet. Choosing a location with good control, such as a sink or bathtub with non-slip mat, having multiple towels ready for drying, and optionally, having a second person available to help with gentle restraint if the cat is resistant. The water temperature should be lukewarm, approximately 100 to 102 degrees Fahrenheit, which is warm to human touch, but not hot. Water that is too hot causes discomfort and stress, while water that is too cold causes the cat to chill and become hypothermic, particularly during the drying process. The shampoo selection must be cat-specific formulation because human shampoos, dog shampoos, and especially human products containing permethrin or tea tree oil are toxic to cats. Cat shampoos are pH balanced for feline skin, which has different pH than human or dog skin. Using inappropriate products causes skin irritation and can cause serious poisoning if toxic ingredients are present. The bathing technique involves wetting the coat thoroughly, but avoiding getting water in ears, eyes, or nose, applying diluted shampoo and massaging it through the coat, and rinsing completely until no shampoo residue remains. Incomplete rinsing leaves irritating residue that causes itching and that the cat will lick off during post-bath grooming, potentially causing digestive upset. The drying process using absorbent towels to remove as much water as possible through gentle squeezing and patting is critical because wet cats chill easily. Long-haired cats may require hairdryer use on low heat setting and low fan speed if they tolerate the noise, or they may need to be kept in warm room until completely dry to prevent hypothermia. Short-haired cats typically dry adequately from towel drying alone. The frequency limitation when bathing is necessary for ongoing conditions should be the minimum frequency that manages the condition, because more frequent bathing causes cumulative oil depletion and skin barrier disruption. Most medical conditions requiring bathing need weekly to monthly bathing, not daily or every few days. The verdict: bathing. Healthy cats who groom normally is unnecessary and potentially harmful through oil disruption and stress, and the never bathe position is correct for this population, which represents the majority of pet cats. Occasional bathing for specific medical conditions, toxic exposure, or severe flea infestation is appropriate and necessary when the benefit of removing the problem substance or treating the condition outweighs the stress and oil disruption that bathing causes. Routine bathing of healthy cats because the owner feels the cat should be bathed or because the owner wants the cat to smell different is not justified by hygiene needs and should be avoided. If your cat is healthy and grooms normally, do not bathe them. Trust their natural grooming capabilities and support coat health through regular brushing rather than through bathing that disrupts natural oil balance. If your cat has medical conditions causing coat problems, follow veterinary recommendations about medicated bathing frequency and technique. Use prescribed shampoos for prescribed duration and discontinue bathing when the condition resolves unless veterinarian advises otherwise. If your cat is elderly, obese, or otherwise unable to groom effectively, address the underlying issue, including pain management for arthritis, weight loss for obesity, or treatment for medical conditions affecting grooming rather than compensating indefinitely through regular bathing. Use bathing as temporary support while addressing root causes. If your cat is exposed to toxic substances, bathe immediately with cat-safe products to remove the substance before the cat grooms and ingests it. And contact poison control or your veterinarian for specific substance removal advice and monitoring recommendations. Bathing should be rare medical or emergency intervention, not routine grooming practice. Respect your cat's natural grooming capabilities, support coat health through appropriate diet and brushing, and reserve bathing for situations where it is genuinely necessary, rather than implementing it as regular practice that provides no benefit while creating stress and skin problems. Comparison 8. Counter access. Allow versus train off. The question of whether cats should be allowed on kitchen counters and food preparation surfaces is one of the most common household boundary disputes in cat ownership, creating tension between owners who view counters as strictly off-limits hygiene zones and owners who accept counter access as inevitable, given cats' natural preference for elevated surfaces. The train-off position emphasizes hygiene concerns about paws that walk through litter boxes, subsequently walking on surfaces where food is prepared. The practical problems of cats accessing food being prepared or interfering with cooking activities, and the principle that human food preparation areas should be maintained as animal-free zones. The allow access position argues that training cats off counters is futile because cats access counters when owners are absent, regardless of training, that any hygiene concerns are managed through cleaning surfaces before food preparation, and that preventing counter access creates unnecessary conflict when the behavior is natural and relatively harmless. This comparison examines what drives cats to seek counter access, what the legitimate hygiene and safety concerns are versus what concerns are overblown, what training methods are effective versus ineffective for keeping cats off counters, and how to make informed decisions about counter boundaries based on household priorities and practical realities. Let's start with why cats are naturally drawn to counters and what needs counter access fulfills. Elevated surface preference is fundamental to feline behavior because height provides safety from ground-level threats, visual surveillance of territory, and access to warm surfaces near heat sources including stoves and appliances. Counters represent ideal elevated resting and observation platforms that cats naturally seek, making counter access reinforcing independent of any food rewards that might also be present. Food motivation drives counter surfing when cats learn that counters contain food, including ingredients being prepared, leftovers left out, or food waste in uncovered garbage. Cats who successfully obtain food from counters develop powerful food-seeking behavior that is extremely resistant to training because the food reward is more powerful than any correction or deterrent owners can realistically implement. Curiosity and investigation motivate cats to explore counters when activity occurs there, including food preparation, running water in sinks, or simply owner presence. Cats want to investigate what the owner is doing, and counters provide access to the activity zone where interesting things happen. The self-reinforcing nature of counter access means that even without food rewards, the behavior persists because the elevated surface itself is rewarding through providing the surveillance and safety benefits that cats naturally seek. This makes counter access one of the most difficult boundaries to enforce because training must suppress intrinsically rewarding behavior rather than simply removing external rewards. Now let's examine the hygiene and safety concerns that motivate training cats off counters. Fecal contamination risk exists because cats walk through litter boxes and necessarily have some litter particles and potentially fecal bacteria on their paws. When cats walk on food preparation surfaces, there is theoretical risk of transferring bacteria, including Salmonella, E. coli, and Toxoplasma, to surfaces where food is prepared. The practical risk is low because cats' fastidious grooming means their paws are cleaner than often assumed, and because proper food safety practices, including washing produce, cooking meat to safe temperatures, and cleaning surfaces before use, mitigate most contamination risks. Food theft and contamination creates practical problems when cats access counters during food preparation, potentially eating ingredients, knocking over containers, or contaminating food through contact. This is particularly problematic with foods that cannot be easily cleaned after contamination, including baked goods, open dishes being assembled, or butter and soft foods where cat contact requires discarding the food. Burn and injury risks occur when cats jump onto hot stoves, land in pots of hot food, or knock over hot liquids while investigating cooking activities. These safety risks are legitimate and can cause serious injury, making counter training important for preventing access during cooking times, even if counter access at other times is tolerated. Interference with household activities, including food preparation, dishwashing, and counter use, creates ongoing frustration when cats repeatedly jump onto counters during these activities, requiring constant removal and creating conflict during routine household tasks. Now let's address the training approaches and their realistic effectiveness for keeping cats off counters. Active supervision and interruption involves consistently removing cats from counters immediately when they jump up, using verbal commands and physical removal to interrupt the behavior every time. This approach requires constant vigilance and immediate response, making it effective only when owners are present and attentive. Cats learn that counters are off limits when owner is present, but most cats freely access counters when alone unless additional deterrents are in place. Environmental deterrents, including motion-activated compressed air devices, sticky tape on counter edges, aluminum foil surfaces, or upside-down carpet runners with nubby side-up, create unpleasant experiences when cats attempt counter access regardless of owner presence. These tools can be effective at suppressing counter access, but they require leaving deterrents in place permanently or until the cat has developed strong avoidance, which may take weeks to months. Removing deterrents too early often results in the cat resuming counter access once the unpleasant surface or stimulus is gone. The never reward principle requires absolute prevention of food rewards from counter surfing, because even occasional successful food theft creates powerful intermittent reinforcement that makes the behavior extremely resistant to extinction. Owners must eliminate all food access on counters, including putting away all food immediately after preparation, covering garbage, and never leaving food unattended even briefly. This level of vigilance is difficult to maintain consistently in real households. The realistic limitation of counter training is that most cats who are trained off counters when owners are present freely access counters when alone, because the intrinsic rewards of elevated surface access outweigh the training against access. Owners who believe their training has successfully eliminated counter access often discover through home surveillance cameras that cats access counters regularly when alone, learning to discriminate between owner-present and owner-absent contexts. Let's examine the alternative approaches when preventing counter access is prioritized. Providing superior alternatives, including tall cat trees near windows, wall-mounted shelves at or above counter height, and cat-accessible elevated spaces in kitchen or dining areas, can reduce counter surfing by satisfying the need for elevated access through alternatives that are more appealing than counters. This works best when alternatives provide better views, are in warmer or more comfortable locations, and are positively reinforced through treats and attention when used. The management approach accepts that preventing counter access completely may be unrealistic and focuses instead on managing hygiene through cleaning counters before food preparation, storing all food in closed containers or cabinets, and training cats to stay off counters during specific times, including during cooking when safety risks are highest. This pragmatic approach reduces conflict while addressing legitimate hygiene and safety concerns. The verdict training cats completely off counters is extremely difficult and often impossible to maintain when owners are not present, because counter access is intrinsically rewarding through providing elevated surveillance and safety that cats naturally seek, making the behavior self-reinforcing regardless of food rewards. The hygiene risks of counter access are real but manageable through proper food safety practices, including cleaning surfaces before food preparation, storing food appropriately, and maintaining good litter box hygiene that reduces paw contamination. The risks do not require absolute counter-prohibition to manage effectively. The safety risks during cooking are legitimate and require preventing counter access during cooking times when hot surfaces and foods create injury risks, regardless of whether counter access is tolerated at other times. The practical middle ground involves training cats to stay off counters when commanded, during times when their presence creates problems, including during food preparation and cooking, providing excellent elevated alternatives that satisfy the need for height, managing hygiene through cleaning before food use, and accepting that many cats will access counters when alone regardless of training. If counter prohibition is a high priority for hygiene or personal preference reasons, implement environmental deterrents that work when you are absent, provide superior elevated alternatives, and commit to never allowing food rewards from counters through perfect food management. Accept that this requires ongoing effort and that lapses in vigilance will undo training progress. If pragmatic management is acceptable, focus on training cats off counters during active use times, clean surfaces before food preparation, store food appropriately, and accept that counter access when alone is likely reality that creates minimal problems when managed correctly. Never leave food accessible on counters, never cook with cats on counters due to burn risks, and always clean food preparation surfaces before use, regardless of whether you allow counter access, because these practices address legitimate hygiene and safety concerns, whether or not training successfully prevents access. Choose the approach that matches your actual priorities and your willingness to enforce boundaries consistently, rather than choosing strict prohibition that you cannot realistically maintain and that creates ongoing frustration from training failure. Comparison 9. Bedroom access allow versus door closed. The decision about whether cats should have access to the bedroom, particularly during nighttime sleeping hours, affects both human sleep quality and the cat-owner relationship in ways that create strong preferences on both sides of the debate. The allow access position emphasizes that cats are social animals who bond through proximity, that nighttime is when many cats seek closeness with their owners, and that excluding cats from bedrooms creates distress and separation anxiety that harms the relationship. The closed-door position prioritizes human sleep quality by preventing nighttime disturbances, including early morning waking demands, nocturnal play activity, and movement on or around the bed that interrupts sleep cycles, and by creating allergen-reduced space for people with cat allergies who need bedroom as relatively cat-free sanctuary. This comparison examines what cats need from nighttime bedroom access versus what humans need from uninterrupted sleep. How to manage the trade-offs between bonding and sleep quality, when closed-door policies are necessary for health reasons, and how to implement bedroom boundaries that serve both cat and human well-being. Let's start with what bedroom access means to cats and why many cats strongly prefer sleeping with or near their owners. Social bonding through proximity is fundamental to cat-human attachment, and nighttime represents extended hours of potential closeness that strengthen bonds. Cats who sleep on or near their owners' beds experience prolonged physical proximity that reinforces attachment and that provides the cat with security from being near their bonded human during vulnerable sleeping hours. Security and comfort that bedroom access provides is particularly important for cats who view their owners as sources of safety and reassurance. The bedroom represents the core den area of the home where the owner spends extended time, and access to this space allows the cat to share the most secure protected area of the territory. Cats who are excluded from bedrooms may experience anxiety from separation from their security source during nighttime hours. Natural crepuscular activity patterns mean that cats are naturally more active during dawn and dusk hours compared to middle of night and middle of day, making early morning hours around 5 to 7 a.m. a time when cats naturally seek interaction. Cats with bedroom access can initiate interaction during these natural wake-up times, while cats excluded from bedrooms may vocalize at doors or engage in destructive behavior to gain access during these biologically driven activity periods. The warmth and comfort of beds themselves attract cats because beds provide soft, warm, elevated surfaces that appeal to feline preferences. Cats often choose to sleep on beds even when owners are not in them, suggesting the bed itself is appealing beyond just the owner's presence. Now let's examine the human side of the bedroom access decision and what closed-door policies provide. Sleep quality protection is the primary reason for closed bedroom doors, because cats who access bedrooms during sleep hours may disturb human sleep through walking on sleeping humans, engaging in play behavior around the bed, vocalizing for attention or food, and creating movement and noise that interrupts sleep cycles. Even cats who sleep quietly for part of the night may create disturbances during early morning hours when their crepuscular activity increases. Allergen management for people with cat allergies requires bedroom as relatively allergen-free space because spending 7 to 9 hours breathing allergen-free air during sleep significantly reduces overall allergen exposure and improves allergy symptom management. Cat allergen levels in bedrooms where cats sleep are dramatically higher than in bedrooms where cats are excluded, and bedding accumulates allergen that is difficult to remove even with washing. Sleep schedule incompatibility occurs when cats' natural wake-up times, around 5 to 6 a.m., conflict with human work schedules requiring sleep until 7 a.m. or later. Cats who demand feeding or interaction at their natural wake time disturb human sleep during the final sleep cycles that are important for feeling rested. Closed doors prevent this early morning interaction demand while allowing cats to occupy other household areas. Couples' sleep dynamics can be disrupted by cats on beds, particularly when cats choose to sleep between partners, when cats move frequently during the night creating disturbance, or when one partner tolerates the cat's presence better than the other, creating relationship conflict about bedroom access policies. Let's address the specific approaches for managing bedroom access decisions. Full bedroom access with boundaries allows cats into the bedroom while training specific rules about acceptable nighttime behavior, including not waking owners before alarm time, not engaging in play on the bed, and settling in designated sleeping spots rather than walking on sleeping humans. This approach requires training investment but provides bonding benefits while managing most disturbance issues. Partial access with nighttime exclusion allows cats into bedrooms during waking hours, while closing doors during actual sleep hours from bedtime until morning wake time. This provides daytime bedroom access for bonding and familiarity while protecting sleep quality during nighttime. The transition requires training cats to accept closed doors at bedtime without vocalization or door scratching. Complete exclusion with alternatives closes bedrooms completely, while providing appealing sleeping alternatives in other household areas, including comfortable cat beds in warm, quiet locations, heated beds during cold months, and elevated sleeping spots that provide security. This approach requires excellent alternatives to prevent the cat from perceiving exclusion as rejection or as loss of security. The training requirements for closed-door policies include teaching cats to settle elsewhere at bedtime without vocalizing at doors, ignoring door scratching or vocalization attempts completely to avoid reinforcing demand behaviors, and maintaining absolute consistency where doors are never opened in response to cat demands. The training typically requires 1 to 3 weeks of consistency before cats accept closed doors without persistent protest. The early morning management challenge occurs regardless of bedroom access because cats naturally become active during dawn hours and may demand feeding or interaction. Solutions include automatic feeders timed for early morning delivery that satisfy food demands without owner involvement, engaging play sessions before human bedtime that tire cats so they sleep longer, and completely ignoring early morning demands to avoid training cats that demands produce responses. Let's examine which situations clearly favor bedroom access versus closed-door policies. Bedroom access is preferable when no household members have cat allergies requiring allergen reduction. The cat exhibits separation anxiety or distress when excluded from owner proximity. The cat settles quietly on the bed without creating sleep disturbances. The bonding benefits of nighttime proximity are valued highly. The bedroom is large enough that the cat can settle away from sleeping humans. Human sleep is not significantly disrupted by the cat's presence. Closed-door policies are necessary when household members have cat allergies requiring bedroom as allergen-reduced space. The cat consistently wakes humans during night or early morning despite training efforts. Multiple cats create too much activity and disturbance for quality sleep. Couples disagree about bedroom access and compromise requires exclusion. The cat has litter box accidents on beds or engages in destructive bedroom behavior. Human sleep quality is significantly impaired by the cat's nighttime activities. The verdict bedroom access versus closed-door policies should be decided based on whether the cat creates actual sleep disturbances, whether allergen management requires bedroom exclusion, and whether the bonding benefits of shared sleeping space justify any minor disturbances that occur. Neither approach is inherently superior for all situations, and the right choice depends on individual cat behavior, human sleep needs, allergy considerations, and relationship priorities between bonding and sleep quality. Many cats who initially disturb sleep can be trained to settle quietly on beds without creating problems, making initial disturbances during adjustment period not necessarily predictive of long-term bedroom compatibility. If your cat currently has bedroom access and is not creating sleep problems or allergy issues, continue allowing access because the bonding benefits enhance your relationship and the cat's security without creating problems that require exclusion. If your cat's nighttime behavior consistently disrupts sleep despite training efforts, implement closed-door policy while providing excellent sleeping alternatives and maintaining strong daytime bonding to prevent the cat from experiencing exclusion as rejection. If allergy management requires bedroom as cat-free space, close doors consistently and focus on maximizing bonding during waking hours to compensate for nighttime separation. Never close doors against persistent vocalization or door scratching without ignoring demands completely, because opening doors in response to demands trains the cat that persistence works and makes future training more difficult. Commit to consistency when implementing closed-door policies and provide appropriate sleeping alternatives that acknowledge the cat's need for comfortable, secure nighttime resting space even when bedroom access is not available. Comparison 10. Ignoring mewing versus responding. The question of how to respond to cat vocalizations, particularly excessive meowing that occurs at inconvenient times, including nighttime, early morning, or during meals, creates one of the most common behavioral dilemmas in cat households. The ignoring approach is based on extinction learning principles, where behaviors that receive no reinforcement eventually stop occurring, suggesting that owners should completely ignore unwanted meowing to eliminate the behavior by removing the attention or responses that maintain it. The responding approach argues that meowing serves legitimate communication purposes, that cats meow to express needs that should be addressed, and that ignoring all meowing creates distress and damages the cat-owner relationship by making the cat feel unheard and ignored. This comparison examines when meowing represents legitimate needs that require response versus when meowing is attention-seeking behavior that should be extinguished through ignoring, how to distinguish between different types of meowing and their underlying motivations, what happens behaviorally when meowing is ignored versus responded to, and how to make informed decisions about meowing responses that address legitimate needs while not reinforcing problematic excessive vocalization. Let's start with understanding what meowing means and what drives cats to vocalize at humans. Adult cat meowing directed at humans is a learned communication behavior that develops because humans respond to vocalizations, while adult cats rarely meow at each other, using body language and scent communication for cat-to-cat interaction. Kittens meow at mother cats to signal needs, including hunger, cold, or distress, but adult cats typically stop meowing at other cats once weaned. The persistence of meowing in adult cats toward humans indicates that humans have reinforced meowing through responses that meet the cat's goals, whether intentionally or unintentionally. The communication purpose of meowing includes signaling hunger or desire for food, requesting access to closed rooms or outdoor spaces, seeking social interaction or attention, expressing discomfort or pain, announcing prey capture in cats with outdoor access, and sometimes occurring during mating behaviors in unaltered cats. Each of these motivations creates different types of meows with different tonal qualities, and cats learn which vocalizations successfully produce desired responses from their humans. The learned reinforcement occurs when meowing produces responses, including feeding, opening doors, providing attention, or engaging in play, teaching the cat that vocalization is effective communication that achieves goals. Once established, meowing continues as long as it continues producing results, at least occasionally, even if responses are inconsistent. The excessive vocalization that becomes problematic typically involves mewing that occurs at inconvenient times, including middle of night, early morning hours, well before the owner wants to wake, during human meals when the cat wants food, or persistently throughout the day for attention. The frequency, intensity, and timing make the behavior disruptive to household functioning and sleep quality. Now let's examine what happens when meowing is ignored versus when it receives responses. Extinction through ignoring operates on the principle that behaviors that no longer produce reinforcement will eventually decrease and stop. When meowing consistently receives no response, including no eye contact, no verbal acknowledgement, no movement toward the cat, and no change in the owner's behavior, the cat initially increases meowing frequency and intensity through a phenomenon called extinction burst, where the behavior temporarily worsens before improving. If ignoring continues consistently through this burst, the behavior eventually decreases as the cat learns meowing is ineffective. The extinction burst challenge is that the temporary increase in meowing during initial ignoring is often more disruptive than the original problem, and many owners give in during this burst because the intensified meowing is intolerable. This teaches the cat that extremely persistent, intense meowing eventually works, making the problem worse than before ignoring was attempted. Successful extinction requires absolute consistency through the burst period without any responses. The timing and context consideration is critical because not all meowing should be ignored. Meowing that signals pain, illness, fear, or genuine distress should receive immediate response, including veterinary evaluation when needed. Ignoring distress vocalizations is inhumane and potentially dangerous if the cat is experiencing a medical emergency. The challenge is distinguishing between attention-seeking meowing versus distress signaling, particularly when the cat's history and medical status are not perfectly known. The responding approach acknowledges meowing by addressing potential legitimate needs, including checking food and water availability, checking litter box cleanliness, assessing the cat's health and comfort, and providing brief interaction if the cat appears to need social engagement. This ensures legitimate needs are met while attempting to avoid reinforcing excessive, unnecessary vocalization. The variable ratio reinforcement problem occurs when meowing sometimes receives responses and sometimes receives ignoring, creating the strongest possible reinforcement schedule that makes meowing extremely persistent and resistant to extinction. This is the worst approach because it combines the problems of both ignoring and responding without the benefits of either consistency. Let's address how to distinguish between meowing that should be responded to versus meowing that should be ignored. Meowing requiring immediate response includes sudden onset vocalization in previously quiet cats, suggesting illness or pain, meowing accompanied by signs of distress including hiding, panting, or unusual postures. Vocalizations during or after litter box use, suggesting urinary tract issues, elderly cat confusion vocalizations that may indicate cognitive decline. Meowing near empty food or water bowls when resources need replenishing. Any vocalization pattern change that might signal medical problems. Meowing appropriate to ignore includes habitual early morning wake-up demands, occurring hours before feeding time, food begging during human meals when the cat has been fed appropriately, attention-seeking meowing when the cat has received adequate interaction, door scratching and vocalization at closed bedroom doors during sleep hours, persistent meowing for treats or special foods beyond regular feeding schedule. The middle ground approach involves responding to meowing by checking for legitimate needs, including food, water, litter box status, and health signs, then ignoring continued meowing once needs are verified as met. This ensures legitimate communication receives appropriate response while preventing reinforcement of excessive attention-seeking vocalization. The scheduled interaction prevention strategy provides regular, predictable interaction, play, and feeding times that meet the cat's needs proactively before demand behaviors occur, reducing motivation for attention, seeking meowing by satisfying needs before the cat must vocalize, to request them. This approach prevents problems rather than requiring extinction of established behaviors. Let's examine specific protocols for managing problematic excessive meowing. The nighttime meowing protocol for cats who wake owners during sleep hours requires absolute ignoring, including no verbal responses, no getting up to check on the cat, and no feeding or interacting regardless of persistence. Earplugs or white noise machines may be necessary during the extinction burst. Automatic feeders timed for early morning can address legitimate hunger while not reinforcing vocalization by making food delivery independent of meowing. The mealtime begging management requires never feeding the cat from human plates or in response to begging, feeding the cat before human meals so the cat is not hungry during human eating times, and completely ignoring begging vocalizations during meals. Consistency across all household members is essential because one person occasionally giving food from the table maintains the behavior indefinitely. The attention-seeking reduction involves ensuring the cat receives adequate daily interaction, including play sessions and social time during times when the owner is available, then ignoring demands for attention at other times. This satisfies the cat's legitimate social needs while establishing that the owner determines interaction timing rather than the cat demanding it at will. The verdict: ignoring excessive attention-seeking meowing is appropriate and necessary for extinguishing problematic vocalization behaviors, including early morning waking demands, mealtime begging, and persistent attention-seeking when adequate interaction has been provided, but only when legitimate needs are confirmed as met. Responding to meowing is necessary when the cat may be signaling genuine needs, including hunger, access to resources, or health problems, and is always appropriate when vocalization patterns change in ways that suggest illness or distress. The critical skill is distinguishing between legitimate communication that requires response and attention-seeking behavior that should be ignored, which requires knowing your individual cat's normal patterns and recognizing when changes indicate problems versus when established patterns represent excessive learned behavior. If your cat meows excessively at predictable times, including early morning or during meals, verify that all needs are met. Then implement consistent ignoring through the extinction burst without giving in to escalated vocalization. Expect temporary worsening before improvement and maintain absolute consistency to achieve extinction. If your cat suddenly develops new vocalization patterns, or if meowing is accompanied by behavior changes, respond by investigating potential health issues and consulting veterinarian rather than implementing behavior modification that might ignore medical problems. Never implement variable responses where meowing sometimes works and sometimes doesn't, because this creates the strongest reinforcement for persistent excessive vocalization and makes the problem nearly impossible to resolve. Provide adequate scheduled interaction and ensure all needs are met proactively to prevent development of excessive attention-seeking meowing, which is easier than extinguishing established behaviors through ignoring protocols that require weeks of consistency to achieve success. Your response pattern to meowing shapes your cat's vocalization behavior powerfully. Choose responses deliberately based on whether the meowing serves legitimate communication versus learned manipulation. Respond appropriately to legitimate needs while consistently ignoring problematic attention-seeking. And never create variable reinforcement patterns that turn occasional meowing into persistent, excessive vocalization that disrupts household functioning and sleep quality. Closing 10 behavioral and training decisions completed. 78 comparisons total across 7 parts of this series. And if you have followed from part 1 through this video, you now have comprehensive evidence-based knowledge covering nutrition decisions, health management protocols, environmental optimization, and now behavioral training that addresses every major dimension of cat care, from kittenhood through senior years. Part 7 focused specifically on the training and boundary decisions that determine whether your household operates smoothly, with clear expectations that your cat understands and follows, or whether ongoing behavioral conflicts create frustration for both you and your cat. These decisions about training methods, introduction protocols, household boundaries, rule consistency, discipline approaches, carrier preparation, bathing necessity, counter access, bedroom policies, and vocalization responses shape your daily interactions and determine whether living with your cat is characterized by harmony or by constant correction and conflict. The underlying principle connecting all 10 comparisons in this video is that effective cat training requires understanding how cats actually learn, rather than imposing training methods that work for dogs or children, but that fail with cats who have different motivations and different responses to correction. Cats learn continuously from consequences of their behaviors, but they do not learn from delayed consequences, from inconsistent consequences, or from punishment that they cannot connect to specific actions. Training that works with feline psychology by using immediate, consistent consequences, by providing appropriate alternatives for instinct-driven behaviors, and by avoiding variable reinforcement that creates persistent, unwanted behaviors, produces cats who understand household expectations and who comply with boundaries because the boundaries are clear and predictable. The decisions covered in this video are not equally important for all households. The carrier training, litter box training, and safety boundary decisions, including preventing access to dangerous substances, are universally important because they affect every cat's welfare and safety. The furniture access, bedroom policy, and counter boundary decisions are household-specific preferences, where either approach can work well as long as it is implemented consistently and as long as the cat's needs for elevated access, security, and appropriate outlets are met through alternatives when restrictions are imposed. The training philosophy decisions, including positive reinforcement versus balance training, and timeout versus redirection, are tools that should be selected based on the specific behavior being addressed and based on your individual cat's temperament rather than being rigid ideologies applied universally. Some behaviors respond beautifully to purely positive methods, while other behaviors require strategic corrections to suppress self-reinforcing actions that persist despite excellent positive reinforcement for alternatives. What matters most is not which specific approach you choose for each decision, but that you understand why you are choosing it, that you implement your chosen approach consistently, and that you are willing to change approaches if your initial choice is not producing desired behavioral outcomes within reasonable timeframes. Training that is not working after 2 weeks of consistent implementation is not going to suddenly start working with more time. It requires reassessment and adjustment rather than persistent application of ineffective methods. The series continues with 3 remaining parts covering environment and enrichment decisions in Part 8, medical and end-of-life care decisions in Part 9, and multi-cat household and special situation decisions in Part 10. These final parts will complete the comprehensive framework for evidence-based cat care that this series has been building across nutrition, health, behavior, environment, and social dynamics. Part 8. Examining environmental enrichment will address decisions about indoor versus outdoor access for adult cats, enrichment strategies for preventing boredom and behavioral problems, vertical space optimization, window access and visual stimulation, puzzle feeders and food enrichment, seasonal environmental adjustments, and creating stimulating environments that meet cats' cognitive and physical needs without requiring outdoor access. Part 9. Covering medical decisions will examine vaccination protocols beyond kitten schedules, dental care approaches, pain management in chronic conditions, diagnostic testing frequency for different age groups, emergency versus routine care decision points, quality of life assessment for terminally ill cats, euthanasia timing decisions, and end-of-life care that prioritizes the cat's comfort and dignity over extending life when quality has deteriorated beyond acceptable levels. Part 10, addressing multi-cat. Dynamics will cover integration protocols when adding cats to existing households, resource distribution to prevent competition and conflict, managing personality conflicts between incompatible cats, addressing bullying and aggression between housemates, making rehoming decisions when integration fails despite appropriate efforts, and creating household systems that work for multiple cats with different needs and personalities. Subscribe to this channel to catch Parts 8, 9, and 10 when they release, and to access the other behavioral and training content we produce, including problem-solving guides for specific behavioral issues, communication interpretation videos that explain what specific cat behaviors mean, and training tutorials for teaching specific skills, including harness walking, medication administration, and husbandry behaviors that make veterinary care less stressful. If this video provided value, if the comparisons helped clarify decisions you have been uncertain about, or if the evidence-based approach to behavioral training resonated with how you want to approach cat care, like the video so that other cat owners discover this resource. The YouTube algorithm favors engagement, and your like helps other people find comprehensive cat care education that goes beyond superficial tips and that provides the depth necessary for making truly informed decisions. Comment below with which behavioral training decision was most relevant to your situation. Which comparison changed your thinking about household boundaries or training approaches? Or which remaining topics in Parts 8 through 10 you are most interested in having addressed. The comments create community discussion that benefits everyone who reads them and that helps us understand which topics resonate most strongly with this audience. We also offer an ebook, Emergency First Aid for Senior and Disabled Indoor Cats, that covers medical emergency recognition and response protocols specifically for senior cats and for cats with mobility limitations, chronic health conditions, or disabilities. This is paid content that provides detailed protocols for situations including respiratory distress, seizures, collapse, severe vomiting or diarrhea, urinary obstruction, and other emergencies where immediate home assessment and response before reaching veterinary care can significantly affect outcomes. The link is in the description for those who want comprehensive emergency preparedness information for vulnerable cats. 7 parts completed, 3 parts remaining. You are building expertise that serves your cat's welfare across their entire lifespan and that separates you from cat owners who operate on intuition, assumptions, and advice from sources that lack evidence-based foundations. Continue through the final parts to complete your education and implement what you are learning to create the household environment and the training protocols that allow your cat to thrive while maintaining the boundaries and systems that make living with cats joyful rather than frustrating. The behavioral and training decisions you make ripple through every aspect of your relationship with your cat. Make them deliberately based on understanding rather than by default based on what seems easiest in the moment. Your cat, and your household will both benefit from the investment in getting training right. We will see you in Part 8 for environmental enrichment decisions that complete the physical and cognitive dimension of comprehensive cat care.